Okay, we are going to start now. Welcome everybody, and thank you for being with us on our first webinar of 2022, NHHAD National Hispanic Hepatitis Awareness Day. As every year, we've served this awareness day to conscientize the Latino community about the impact of viral hepatitis in our community. Not only hepatitis A, B, and C, sometimes we include the but also about differences in chronic and acute hepatitis. And for today, we are going to have the winner, the title Medically Tailored Meal Intervention. It's about the nutritional requirements, nutritional needs that people living with hepatitis, chronic hepatitis, require and has. And for that, we have Alison Schiff. Alison is Business Development Associate at God's Love with the Liver. God's Love with the Liver is an institution in New York City, because it's an institution, like we already know about it, that delivers meals to people that cannot cook for themselves. Initially, it was for only HIV, people living with HIV, but also now it's extended to different types of diseases, including dementia, hepatitis, cancer. So anyone who cannot cook for themselves or go to the market to buy itself, God's Love with the Liver, prepare foods and deliver to them. So she works in God's Love with the Liver to cultivate partnerships with hospitals, health systems, managed care organizations, and community-based organizations like ours to engage and inform about God's Love services. Alison has a deep history of presence in the healthcare industry with considerable experience in providing facility and payer knowledge. Alison has created and developed best practice operational policies and procedures in addition to system design while ensuring compliance with rules and regulations at the federal and state levels of governance. Alison works to support the advancement of health equity with strategic research into identifying areas of immense need in historically marginalized communities, Latinos, gay people, people living with HIV, and establishes a platform to educate on God's love, presence, and abilities. Alison also brings back the voice of the community to ensure that God's Love with the Liver is at the forefront of the latest trends to achieve clinical program success. Alison is a published content author and has presented several national meetings throughout the country as a subject matter expert, and was recognized by Becker's Hospital Review as one of the 102 women in health IT to know. So we asked Alison. Alison, thank you very much for being with us today to make this important presentation. I think we need to know a little bit more about nutrition for people living with hepatitis. Thank you.
Yes, thank you so much, Luis, for having me, and thank the Latino Commission on AIDS as well. This is an amazing opportunity, and I'm so happy to be here doing this with you all. So, Luis, if it's okay, I'm going to share my screen and I'll get started, okay?
Yes.
Beautiful. All right. So welcome, everybody. Like Luis said, my name is Alison Schiff. I'm a Business Development Associate at God's Love We Deliver, and I'm very excited to be speaking today with you about who and what God's Love We Deliver is, what our medically tailored meal and nutrition education program consists of, how we can understand the critical importance of nutrition in chronic disease management and viral hepatitis in particular, and how we can best work together to provide our amazing services that will greatly aid the lives of the community present here today and your loved one as well. So today, a little bit of housekeeping. We're just going to cover the following. What the mission of God's Love We Deliver is. We're going to learn about the importance and significance of nutrition in relation to liver disease and hepatitis specifically. We're going to talk about the services provided by God's Love. We'll define what our medically tailored meal intervention means and review the referral process that will help provide those meals to you, your loved ones, or anyone you know who has need of God's Love services. And then at the end, we'll take some time for any questions, thoughts, ideas, brilliant perceptions. We welcome them all. So let's start with the mission of God's Love We Deliver. And to give you a little background, in 1985, a hospice volunteer named Ganga Stone paid a visit to an AIDS patient that changed her life. And that patient was too ill to cook for himself, so Ganga took charge. A meal was prepared and delivered on the next visit, and this brilliant stroke of inspiration was born. Something as basic as delivering a meal could bring dignity, could bring recognition, and hope to a desperate situation, and that's how God's Love was born. So the mission of God's Love is to provide help and improve the health and well-being of all people living with serious illnesses by alleviating hunger and malnutrition. God's Love, of course, has been dedicated to transforming the lives of those individuals for more than 35 years. And though, as Louise said, we started as a direct response to the HIV/AIDS pandemic, in 2001, we started expanding our services to include more expansive diagnoses, and we continue to this day to expand as needed. So from the beginning, we've really known that our core competency is to address food insecurity and malnutrition, and really to ensure that we're giving our clients one less thing to worry about as they deal with the circumstances of a life-altering illness. We prepare and deliver high-quality nutritional meals. We provide continuous nutritional education and counseling to anybody who's dealing with any of those illnesses. Some things to note: there is no charge for services whatsoever. We also provide services to the undocumented community, and there never has been, and there never will be, a waiting list for God's Love services. So while God's Love specializes in medically tailored meal intervention, nutritional education, and counseling for a number of diagnoses, today I'm going to focus on the role that nutrition therapy and medically tailored meals play specific to liver disease and viral hepatitis in a meaningful and impactful way. Nutrition therapy in liver disease is really centered around preventing disease progression and managing any additional complications. Everything we eat passes through the liver, so we have to pay special attention to nutrition and to the diet in order to support healthy liver functions. Early dietary changes can reduce the stress placed on the liver, and it can also help speed up the recovery process during the course of the disease as well. Medically tailored meals focused to liver disease will help support positive health outcomes. They'll greatly improve medication adherence, which is pretty critical for hepatitis management. They'll help reduce repeat hospitalizations and directly impact malnutrition and any additional complications that arise from malnutrition. It's extremely important for anyone living with liver disease and hepatitis to monitor their diet and eat the right types of foods. So let's break down some terms here for context. The liver is the largest organ and one of the extreme workhorses of the body, has many important jobs. One of those jobs is to act as a filter and a detoxifier for your body. In addition to being essential for digesting food, almost all of the blood in your body will pass through the liver, and when it does, it breaks down substances like alcohol, caffeine, prescription or over-the-counter drugs, and street drugs as well. And our bodies naturally produce some harmful chemicals or poisons, but those are also broken down by the liver. And that's how the liver is able to do its job to act as a filter, which will clean your blood. The liver is also turning proteins and sugars into things that your body needs, and it stores vitamins, hormones, cholesterol, and minerals. And when your body has need of those, the liver will release those chemicals and nutrients to help aid your system. Now, on the other side of all the good work that the liver is doing for your body, there are unfortunately more than 100 types of liver disease that have been currently identified, with the most common one being hepatitis. Hepatitis, which is an inflammation of the liver that can result from either infectious causes like bacterial, viral, parasitic, or fungal instances, as well as non-infectious causes like drugs, metabolic diseases, alcohol, and autoimmune diseases. Now, the most common causes of hepatitis in the United States are alcohol abuse and viral infection. And hepatitis can be classified as either acute or chronic, with chronic hepatitis being an instance that will last over 6 months and can possibly lead to liver failure, cancers, and cirrhosis. Cirrhosis is something that occurs over time. That's when damage to the liver results in scarring, the liver gets irreversibly damaged, and this can result in complete liver failure, which is a severe and life-threatening illness and condition that will require a liver transplant for survival. There are 5 viruses that cause the different forms of viral hepatitis, which are hepatitis A, B, C, D, and E. Hepatitis A and E typically spread through contact with food or water that has been handled with poor hygienic practices and inadequate sanitation treatments, while hepatitis B, C, and D are spread through contact with an infected person's blood or body fluids. Viral hepatitis can be treated with medications and a well-balanced diet, as crazy as that may seem, in order to help mitigate the disease and its effects. Now, nutritional monitoring is absolutely critical for this disease's management. In some people, chronic hepatitis can progress, more significant liver damage can occur, and certain nutritional adjustments may be required. For instance, people who have what's called decompensated cirrhosis, which is advanced liver disease, can develop extensive liver scarring, and they may need to follow a highly specialized and much more rigorous diet to accommodate a liver that, in essence, is no longer able to function properly. But your healthcare provider can help you determine exactly how tailored your diet should be. Your healthcare provider and registered dietitian should always be consulted for that as well. But adopting a healthy diet early on can help minimize damage and protect your liver on a daily basis. Now, proper nutrition, like I said before, may seem a little crazy, but it's very important in managing hepatitis. And food safety guidelines are also strict adherence is absolutely mandatory as well. So for instance, you want to make sure that the water you drink and the food you eat are clean, especially when you're traveling to other countries. Now that the world is opening up a little bit, we've got to consider things like this for people who are suffering from liver diseases. Most cases actually of hepatitis A infection result from poor cleanliness during food preparation, especially with shellfish. When handled properly, shellfish is as safe to eat as any other source of food, but contaminated shellfish that has not been thoroughly cleaned and cooked is strongly associated with those hepatitis A outbreaks. And the diet for those suffering from hepatitis should include foods that are easy on the liver and exclude foods that cause the liver to work harder, as this can delay a patient's recovery from the disease. So you want to eat a diet that's high in fresh whole fruits and vegetables, whole grains, and legumes. You really want to avoid processed foods as they tend to put increased strain on the liver. You also want to consume foods that are high in fiber and look to consume between 25 and 30 grams of fiber per day. We want to focus on high fiber rich foods like whole wheat bread, whole grain cereal, beans, peas. I particularly happen to love my family's healthy gandules preparation. That's just me. But you also want to eat rich in fiber fruits and vegetables like pears, strawberries, raspberries are super high in fiber, carrots, broccoli, and Brussels sprouts, for instance. Consumption of leafy green vegetables in particular may provide benefits to those managing hepatitis, and studies have shown that these can lessen the fatty acid composition in your liver. You also really want to limit salt consumption as it may contribute to fluid retention. And heavily processed foods like snack foods, convenience store foods, and microwavable meals are often what will put somebody over the limit of salt intake. You want to aim to drink about 8 8-ounce glasses of water per day, which will help flush out your system as well. You want to avoid eating high fat and fried foods that contain saturated or trans fats, and instead choose healthier fat options like fish like sardines, salmon, and trout, and then flax seeds, avocados, and nuts, and cook with vegetable-based oils, which does include olive oil, of course. You want to limit foods with added sugar, as those can also contribute to fatty buildup in the liver, and really reduce the intake of sugar in general for things like sweets and artificial sweeteners as well. And of course, critical to the liver, we have to abstain from alcohol. You also want to read drug labels to know the risk that certain drugs can pose to the liver. And of course, again, always consult your healthcare provider or your registered dietitian to ensure that you're preparing and adhering to the best diet for your condition. And for any patients that are able to do so, going for a walk after meals can help improve the circulation of the blood through the liver, which will help promote that healthy lifestyle once the meals are eaten. So, as I think we've just seen there, a healthy and well-balanced diet can help support the liver and help manage the symptoms of hepatitis as well. Constant fatigue, digestion issues, joint pain, and trouble eating full meals are very common and recurring symptoms. And we have research that's shown that malnutrition and loss of muscle mass become more common as the condition progresses, and some people also have a difficult time maintaining a healthy weight. Malnourished adults are 50% more likely to be admitted or even readmitted to a hospital setting, and that's a factor in almost 2 million hospital stays annually. Medically tailored meals, like the ones produced by God's Love, can help do battle with these issues and can help reduce the numbers of hospital admissions. They can reduce emergency transport service needs, emergency department visits, and as an added benefit to the patients, it helps to improve hospital discharges to the home setting rather than to a rehabilitation center or another institutional setting. And in fact, just a cool point here is God's Love can actually provide our meals for 1 year for the average cost of 1 stay in the hospital, which is bonkers to think about. And we've also got studies that have shown that people who get our meals demonstrate a 50% marked improvement in medication adherence, which of course is so important for those dealing with hepatitis and liver disease, as well as promoting better blood work results and, again, better overall health outcomes. So how do we do what we do? As I mentioned before, for over 35 years, we've prepared and delivered life-sustaining meals for people who are living with severe and chronic illnesses like hepatitis and liver diseases. And those people are unable to provide or prepare meals for themselves, as Luis also said. And in addition, recently to serving our 30 millionth meal, which you may have seen on the news over the last couple of weeks, humble brag, we did have Hugh Jackman and Sutton Foster here, which was crazy cool. But our registered dietitians will also, in addition to that meal preparation, perform ongoing nutritional counseling sessions. And there are bilingual opportunities in English and Spanish, and they'll help our clients with things like managing their diet and making sure that they adhere to their medications. So I'm going to talk about what that service looks like. So firstly, we are the leading provider in the New York metropolitan area of medically tailored home delivered meals, nutritional counseling. And as I mentioned before, our goal is to provide support through our meals, through our comprehensive nutrition care and education, and to help relieve systemic issues of hunger and malnutrition. We want to make sure that we can reach every eligible individual who's dealing with a life-altering illness and has physical limitations of movement that could benefit from the services provided by God's Love. Our meals, as I mentioned, are designed by our registered dietitian nutritionists to match our clients' diagnoses, which, since we heard about before, is critical for disease management, particularly for viral hepatitis. And those meals are delivered by our dedicated team of drivers. And in fact, during the height of the pandemic, we were deemed an essential service provider. So we have not closed our doors. We have not stopped services for a single day during the past 2 years. And as to the population we serve, generally speaking, they are what we call the sickest of the sick. They are those who are seriously ill, on the verge of being seriously ill, on the cusp of hospitalization or rehospitalization in many instances. This is the population that is dealing with a diagnosis that will benefit from nutritional intervention, right? Just like we've seen with liver disease and hepatitis, in addition to HIV/AIDS, many types of cancer, severe diabetes, and even those with severe mental diseases like dementia or early onset Alzheimer's. Since many of these illnesses have a physical effect, like chronic fatigue from hepatitis, limited activities of daily living, and a lot of times a lack of support in the home setting will equate to a severe and immediate need for nutritional intervention, which is what God's Love provides. So in terms of our last year in a snapshot, we served over 2.5 million meals to just about 10,000 clients, which included their dependents and their senior caregivers as well. Now that translated to 11,000 meals being cooked and delivered each day, totaling in over 200,000 miles being driven by our team, which is no small feat in New York, by the way. I mentioned a few specific ones earlier, but we do see over 200 unique diagnoses, and over 90% of our clients have a secondary diagnosis, with many having multiple diagnoses and comorbidities as well. And of course, we cannot do what we do without our volunteers. They are amazing. Our staff is outnumbered 10 to 1 by them. In fact, I started out as a volunteer with God's Love before I joined the organization as an employee. So right here, this is an example of one of our vans you may have seen around the city, and our meal preparation and packaging actually starts at 3 o'clock in the morning. Yes, there is a 3 o'clock in the morning when our chefs arrive at our building in Soho. And along with our chefs are wonderful volunteers whose first shift starts at 6, and yes, they do arrive then. They'll prepare and pack the food in our 10,000 square foot kitchen. Sometime before 8:30 in the morning is when our drivers will come in. They will pack the meals into our vans, and then they will set out to distribute across the whole city. Our meals are delivered Monday through Friday, and each of our deliveries contain between 2 to 3 meals per day. So for example, if a client is getting 5 days worth of meals for lunch and dinner, they'll receive a total of 10 meals. Now, approximately 30% of our clients choose to have their meals delivered 1 day per week, which means we would coordinate delivery of all of those 10 meals into a single day of the week. Additionally, we can also deliver to single room occupancy settings and family shelters, so long as they have the proper infrastructure to store and reheat the meals. So I said medically tailored meals a few times, but what does it look like and what does it really mean? Medically tailored meals are meals that are approved by a registered dietitian that will address appropriate dietary therapy based on evidence practice guidelines. Basically, meal recommendations that are based on the registered dietitian's nutritional assessment, meaning just like a doctor will come in, they'll do an assessment on you, so will the nutritionist. And in addition to that nutritionist's assessment, a referral by a healthcare provider will help us so that really we're looking at diagnosis and disease management to really be the drivers for what we do here. So those dietitians that we have will perform medical nutrition therapy, which helps ensure that every one of our clients will get the right type of meal that will match the circumstances surrounding their illness. Now, all of our meals will start as low sodium, heart healthy meals. Our dietitians can refine further from there if needed. And we do honor a lot of different dietary restrictions. About 30% of our clients, I think, do receive modified meals, so those clients don't have to worry about not being able to eat their food. And those restrictions can range from things like acid blend, if they can't have anything with tomatoes, for instance, to those who can't have any fat, or those who have dairy restrictions or renal-based restrictions for kidney issues. We follow our clients through what we like to call the trajectory of their illness. So as they move, so do we. For instance, if they're undergoing chemotherapy or they develop issues with chewing or require physical modifications to the food, we can change the meals to a soft minced or pureed option. And we can also omit specific proteins as needed, which I know I mentioned shellfish before, but I am actually allergic to shellfish. So as somebody who has that allergy, I appreciate the accommodations we can make here, and several other different types of food allergies as well. All of our clients are referred for meals and medical nutrition therapy, and both the education and the appropriate meals are critical for our clients to remain their healthiest. Our registered dietitians perform their process through assessment, diagnosis, intervention, monitoring, and evaluation. And that's used to ensure the highest quality care. And basically, in essence, the team will assess and determine the problem, figure out what to do, and measure if it's working. At the start of our program, a nutritional assessment is performed by our registered dietitians. Now that includes a complete review of the client's medical and nutritional history, any lab values, notable signs or symptoms, and any medications or treatments currently being prescribed to the client. Again, very critical for people who are currently on medication for liver disease and hepatitis management. And in addition to the treatment plan that's being developed to create the medically tailored meals, our registered dietitians will conduct regular counseling sessions to help address any nutrition-related issues, like working to manage diets with medication intake, and a nutritional assessment is then performed typically at the 6-month mark of our services. And the reassessment will review everything gathered from the initial assessment and will examine any new measurables to address disease progression goals, as well as help them make modifications to the treatment plan if it's needed. The department actually also offers many informational and disease-specific booklets, also available in English and Spanish and other languages as well, that'll help keep the clients updated on their diet and illness. And I have to say, although I'm not one of our registered dietitians who's presenting here to you today, they help prepare a lot of the information that I'm able to present to you. So you know it's coming from a good source. And the work of our registered dietitians will support the health and recovery on so many different levels for our clients. So I wanted to show some examples of our food and our volunteers, pictures that were hopefully, as you can imagine, taken pre-COVID, before mask life. And we do know and we recognize that meals benefit from visual appeal. So we do try to bring as much color as possible to entice and whet appetites. Our meals contain no preservatives, no starters, and no fillers. We have breakfast, lunch, and dinner options with a wide variety of diverse cultural influences. Personally, I have to say that our vegan sancocho is one of my favorite soups. And all of our entrees contain a protein, vegetable, and a starch. And if there aren't any protein restrictions, our menu can include fish, chicken, beef, pork, and vegetarian options that will still, of course, include a protein because it's important for each day of the week. We are also very focused on sustainability for what we consume here at God's Love. We only purchase fish that is sustainably sourced and certified by the Marine Stewardship Council, and all of our ground beef is antibiotic and hormone-free and bought from a local New York State vendor as well. We also have a rooftop garden, where I actually just was a few moments ago here at our building, that provides fresh herbs that make our meals taste great with no carbon footprint needed for trucking and no waste. And of course, we also give a dessert whenever it's possible. So all of our meals here are freshly prepared, they're blast chilled, and they're sealed. And I want to call out that all of our food is packaged in BPA-free containers. And in the top right, you'll see a picture of our sealed entrees, which have a film covering that cannot be removed until the food has been heated up to the right temperature. That label that you see there also contains the meal specifications, including what type of meal it is, what type of protein it has, and the reheating instructions. We are very focused on maintaining the highest food safety standards, and our kitchen is subject to the same rigorous inspection as food services throughout New York City. And in fact, if we were a restaurant, we'd be able to boast an A grade, which we are super proud of. So some of the extra special things that we do here at God's Love. Every client will receive a homemade personalized birthday cake, so long as their diet allows, and a card that's created and signed by staff and volunteers. And while God's Love in particular is not a religious organization, we do provide special holiday meals for Thanksgiving and what we call winter feast holidays, which occur before the new year. We always include a second meal as well to give to our clients. It helps give them the option to invite a guest or a loved one to share that meal with them. And in the event of any emergency, we also prepare special emergency meals and non-perishable shelf-stable meals, like if inclement weather storms happen or blackouts. I mean, we live in New York, so literally anything is possible, and we're always prepared for it, thank goodness. And as I said before, we also feed our clients' dependents under the age of 18, as well as their senior caregivers, and that is regardless of their health status. Additionally, we're also now serving veterans in the New York City area with a mental health diagnosis, including PTSD, anxiety disorders, major depression, bipolarism, schizoaffective disorders and schizophrenia, and substance abuse disorders as well. And we also have recently started a gestational diabetes program, and that's called Healthy Starts. And that's used as an opportunity to offer treatment and preventative care to address the current and long-term health of both the parent and the child. And it's the first preventative program that's offered by God's Love. And in fact, it's the first of its kind in New York City. So how do we refer? There are some simple steps that would need to occur when referring a client for the meal delivery component of our program. A potential client, of course, can refer themselves to the program. We could receive a verbal release to obtain the person's medical records and have anyone else speak on their behalf, or we can receive a HIPAA confidentiality release form signed by the potential client. And of course, for HIPAA protection, we cannot speak to or contact anyone until we have that signed form. The eligibility for God's Love service is medically based only. It is not financially based in any way, shape, or form. We are eligible to clients who are living with those serious illnesses within the 5 boroughs of New York City, who are unable to shop, prepare, or cook meals for themselves and their loved ones. The client's activities of daily living are usually pretty limited, like being unable to stand for 20 minutes or walk for more than 20 feet. And these are people who are usually unable to attend a physician or NP or PA or checkups without assistance, or completely homebound as well. So we do accept clients with a variety of medical diagnoses, like Louise said. We expanded beyond HIV and AIDS as pretty much our direct response many years ago. So for example, you'll see on the left-hand side here that some of the primary diagnoses will be cancer, MS, CHF, congestive heart failure, HIV, AIDS, of course, COPD, severe diabetes, hepatitis C, and various liver diseases. And then on the right-hand side, you'll see instances where we may not not be able to have an eligible client. So for example, anyone who's having an active cancer treatment right now could be eligible for our meals. But somebody who is going through cancer in remission, I will say 100% congratulations to, but we may not be able to provide meals for that person. But there is an eligibility check available on our website, so anybody can go online and check there and make sure that their diagnosis is covered for God's Love services. Then in the home setting, we want to make sure that the clients have the right resources to receive our meals. So some simple things here. They have a refrigerator and a freezer to safely store meals. I did mention the single room occupancy or group settings earlier. We prefer that they have a personalized set here so that they can keep track of the meals that we're sending and they're able to ensure its safety. We want to make sure then that they've got an oven, a stove, or a microwave, which can reheat the meals for them to that proper temperature. And of course, delivery time, which can be very similar to somebody coming to repair an appliance in your home. We want to make sure that they're there and available for regular times during the day. And as I mentioned, delivery, which occurs between 1 to 2 days per week between the hours of 8 a.m. and 4 p.m. We know it's a long stretch of time. And so we do work to accommodate our patients who may have regular doctor's appointments. We may have to reschedule a day, and we'll always work with them on that. And the important figure in that is a working phone so that we can contact them and they can contact us. Now, as to what makes the complete referral, there's a medical form that has to be signed by a physician, a nurse practitioner, or a physician assistant that will list either the chronic illness or the code that's specific to that diagnosis, as well as the physical limitations that are being experienced by the client. There's also that HIPAA confidentiality form, which I mentioned, which will allow God's Love to reach out to people that you list with questions. And of course, we want to encourage our clients to add any family members or neighbors and children who would be able to speak with on their behalf. And then we've got our policies and procedures, which will list out everything we're going to do. And as I mentioned again, and I'll say it again here, the valid phone number is critical for intake and ongoing communication. And then we also like to have additional special information there, like languages. It's extremely helpful for us so that we can make sure that we have a seamless accommodation ready. And any medications, any statistics that we have so that we can do that monitoring component with our nutritionists, that they're able to gauge how well you're doing from the services that we provide. We'll get that baseline level, and then at the end of our engagement, we'll be able to measure the success, which is crazy awesome. So there's a couple different ways to get to that referral component. Our forms are available on our website. They can be filled out and submitted online through that website, or if the client prefers, they can be put into fillable PDF and then printed out or scanned and emailed to us. We do require that medical provider's signature as well, and then all of those forms can be sent back via email, via fax, of course, through the website directly. We even can accept forms through our secure text feature, and I'm pretty sure we'd take carrier pigeon too. So at this point, I'm going to stop. I'm going to pause for breath because like any good New Yorker, I can just rattle on and on without forgetting to take a couple of those in between. And I just wanted to see if anybody had any questions.
Thank you very much, Alison, for this presentation and the amazing job that God's Love We Deliver do for so long. It's very important, and I know many New Yorkers and even beyond New York City, people receive the services from you, which is incredible. I think there's a couple of questions in the question and answer. I work with young people who suffer from mental illness, and I need information on how to prepare food for them in my workplace.
Okay, so currently the mental health diagnosis portion of our program is open to veterans, but if you are working in a communal space setting where you are preparing the food for them, which is amazing, by the way, we actually used to have our registered dietitians would do webinars on how to do food preparation. Since COVID, I'm pretty sure that's been eliminated, but you can absolutely poke around on the nutritional section of our website because I think there are still some videos that are listed there which could be helpful for you.
I was going to ask you, like, if there's any difference between diet for hepatitis B and hepatitis C, but also when at the end of the presentation, you mentioned that on the list of the conditions that you provide services to was hepatitis C, but hepatitis B was not there. Because knowing that hepatitis B is also a chronic condition, is there a reason why it's not?
Oh, yeah. So hepatitis B is most commonly caused by the other hepatitis viruses and pretty much always occurs in conjunction with hepatitis D. If hepatitis D is acquired at the same time as hepatitis B, there's a complete recovery component, which is pretty incredible. But hepatitis B is really more of a mild or subclinical acute hepatitis. It can lead to cases of chronic hepatitis or an asymptomatic carrier state, which is not good. But most symptoms really are looking at a limited shelf life of 1 to 3 months there. So that's really more of a temporary thing. So for chronic hepatitis, that's really where the constant disease management component will come in.
Is there any consideration on vitamin D deficiency? People who living with hepatitis C has usually deficiency in vitamin D. Is there any consideration into that?
Yeah, I mean, vitamin D is pretty much critical. It's what helps your body absorb calcium and phosphorus. There's many different vitamin D deficiencies. I, for example, I'm going to go TMI on you, but I'm very pale. So my brother likes to tell me to go step outside because you can get vitamin D from the sun, which is, not very helpful for him. But there are certain milk options, of course, that you can take to improve your calcium intake. But I'm going to stick here with the leafy green option. Spinach actually has an extraordinary amount of calcium in it, and a lot of leafy greens do as well. And yes, I will absolutely put the link to our website in the chat here.
There is a question about what is the average cost per client or patient? Is it easy to replicate this program? Is funding from private funders, donations, federal state funds, or how expensive it is?
Yes, so that is a question that I don't think I can answer. I'm pretty sure that's business practice related. But on the whole, I mean, we are lucky enough to be able to do what we do in a nonprofit setting. And I think the most important thing I can mention is that there are no charges ever to our clients. No one will ever receive a bill for the services that we do.
Any other question for the participation? I was like, if I'm one of your patients, right, I'm receiving your meals, and let's say I have hepatitis C chronic, and all of a sudden I am diagnosed with HIV. So does it change? The diet going to change? Is who evaluates my case and how is changed or updated?
Mm-hmm. Yeah, absolutely. So one of the reasons that we ask on the provider form for every disease that you're currently being treated for is so our nutritionist can have every bit of information that's necessary to specifically tailor that meal to your needs, right? And that's what makes God's Love so different and I think so special, is that we'll factor in all of those diseases and all of the special components to them. So for example, there may be, especially with hepatitis C, there are instances where caffeine intake actually, I think, can be better for you. Different cases of hepatitis may not be so good. In hepatitis C, you want to avoid high iron foods. And in the other comorbidities, like HIV, you may need necessarily a slightly higher iron intake. So that's the work that our nutritionists do behind the scene to balance the scales and make sure that the disease that is currently being presented to us with our clients is being hit from all levels for disease management in an adequate and appropriate fashion.
Another job that you guys are doing, because that is amazing, already a lot of your work to do. And this is a question like, do you have any consideration about cultural? Like if I'm Latino, do I receive a different type of diet?
Oh, yeah. Yeah, so our meals go through a 4-week rotation schedule. We have so many cultural influences. Like I know I mentioned the sancocho. I'm serious about the sancocho. Like it's real. But we have chefs who all have amazingly ethnically diverse backgrounds, and they bring a lot of that to the table when they talk about the meals that we're going to be preparing. I think we're actually going into the summer menu right now, which is super exciting to see it unfold. So our chefs work hand in hand with our registered dietitians to do the menu planning and the meal preparation. And we do factor in who our clients are and the diets that they want to see as well. So we do have specific items within our menu that are Latin-based and delicious. Well, everything's delicious, and I've had it, so I'm saying that. But we also have Asian influences on there. We have East Asian, we have West Asian, we have good old-fashioned American comfort food. We have influences from so many different places. You know, there's a few good Italian options on there as well, if I'm remembering correctly. Oh, and the escabeche fish is actually really, really good too. But we've got whole grain salads, we've got soups, we've got the entrees that I mentioned, and then the desserts. I have to say I'm a huge fan of the red velvet cookie that we have over here. But again, we're really looking to represent such a wide swath of cultures, because New York is a wide swath of cultures. So we want to make sure that we're not gearing all of our meals toward any one type of person. So yeah, and believe me, as Yo Como Latina, I've you know, had my say as well.
I'm assuming that also have consideration of people who don't eat pork and cultural or religious. Yeah.
Yes, absolutely. We will make those accommodations for you. We can go to a strict vegetarian diet as well, if that will kind of solve all of the issues in one fell swoop.
Okay. One more question from my part is like, how many times a year you rotate the diets, the recipe? Because I'm guessing like eating the same meal in a program might be boring sometimes. And then,
yeah.
So I'm sure like in a cycle, you may have a different things that rotate every day. So we don't eat the same thing every day, right?
Yep, exactly. We do not have the same thing every day. We have a 4-week rotation, as I mentioned. So for the period of 1 month, there will be, you know, of course, making allowances for any severe restrictions that are needed. There will be a different meal that's had every single day for that 4-week rotation. Generally, what we do is quarterly, we're going to go through and assess. And of course, as any new diseases or conditions get added or new studies evolve showing us that maybe the improvements could be focused to a different kind of area, we'll make adjustments from there on an as needed or ad hoc basis.
Is there any other question from our participants today? No? Well, I think with this we're going to close. Alison, thank you very much for being with us today and bringing the information about God's Love We Deliver. I always
Me too, don't worry about it.
Yeah, it's an amazing institution. It's an amazing way of serving the community and all this, especially those who need it the most. And thank you very much for your job. And thank you very much, everybody who's been here with us today. I hope to see you on Friday and see a webinar to NHHAD about the impact of hepatitis in the United States. Is focused on the life. So thank you very much and see you on Friday.
It was my pleasure. Thank you all. Bye-bye.